Good afternoon. Good afternoon, and thanks for coming. I am Jim Healy, and it is my very high honor to welcome you to UMass Chan Medical School's special investiture ceremony. And we will begin in just a few moments. For the comfort and enjoyment of all of our attendees, we kindly ask that you now turn off all cell phones and pagers. We thank you for your cooperation. This will be a wonderful celebration. We will be starting shortly. Good afternoon again. Please join me in welcoming the 2024 recipient of the Chancellor's Medal for Distinguished Service, carrying our university mace and leading the procession, Dr. Jean Fraser. And now please welcome our esteemed group of named professors, including the newest recipients of endowed chairs and the distinguished leadership of both our UMass system and the UMass Chan Medical School campus.
Go ahead and sit, please. Good afternoon, and welcome to the University of Massachusetts Medical School's University of Massachusetts Chan Medical School's special investiture ceremony. I'm Terry Flott. I'm the provost here at UMass Chan Medical School and the dean of the T.H. Chan School of Medicine, the only public institution of its kind in Massachusetts. We're gathering here today to celebrate our 24th investiture, having just a few short months ago celebrated our 23rd such ceremony. Adding a special investiture so soon after our annual convocation investiture ceremony reflects just how steep our growth trajectory has been under the outstanding leadership of Chancellor Collins. It's very encouraging and inspiring to all of us that we have another opportunity to come together for investiture, because this particular event focuses on our single most valued institutional resource, our faculty. Our faculty contribute to the breadth and depth of renown and the impact of the Commonwealth's world-class public medical school. With collaboration as our force multiplier, we are indeed advancing together. We only need to look to last month's Nobel announcement to fully appreciate just how exceptional our faculty are. They are the engine that drives this institution forward and shapes our future direction. Our faculty, especially our august group of endowed chairs, which includes Nobel laureates Victor Ambrose and Craig Mello, are unsurpassed standard bearers of academic excellence. They all personify everything that makes UMass Chan Medical School such an outstanding academic community. Endowed chairs, as many of you know, are incredibly important and highly coveted designations that enable us to recruit, retain, and recognize the myriad and profoundly impactful contributions of our faculty. It has indeed been inspiring to observe how our strategic focus on expanding the number of endowed chairs, the number of endowed faculty positions, has resulted in incredible gains for our institution. It's hard to believe, but we now have 75 endowed faculty positions, 71 of which are currently held by some of our most stellar faculty members, including 25 women faculty. While we have much more work to do to achieve gender parity, when Chancellor Collins and I arrived here, there was only one endowed chair occupied by a woman. We have made great progress, with 1/3 of the endowed chair positions now held by women. We will continue to make progress with our special group of donors who decide to endow a chair for faculty use in perpetuity. The term partner is especially relevant at today's proceedings, as our primary clinical partner, UMass Memorial Health, has made a most generous gift to UMass Chan. That gift, with matching funds from the Chancellor and the university, has enabled the creation of 5 new endowed chairs to support the academic leaders of 5 of our shared clinical departments, now and again in perpetuity. This is an extraordinary demonstration of the support and confidence and the leadership of UMass Memorial Health, represented here by Board Chair Dr. Linda Young and President and CEO Dr. Eric Dixon, who I must mention is a proud alum of UMass Chan Medical School, as well as other trustees and senior clinical system colleagues, all of whom deserve our gratitude and thanks. We understand and appreciate that all of our philanthropists, including, of course, UMass Memorial Health, are in essence forever linking themselves, their families, and their institutions with the missions of this medical school. This is a very public and permanent bond. It poignantly illustrates our Advancing Together brand. As the current stewards of this tremendous public resource, it is our obligation to select faculty members worthy of this distinction, and today's ceremony will recognize 8 of the most deserving colleagues. Each of these 8 faculty honorees exemplify this caliber of excellence as embodied in their own sphere of expertise. They have made outstanding contributions to education, basic and translational research, and clinical care as prominent educators, researchers, physicians, and leaders. Each and every one is deserving of their special recognition, and we look forward to highlighting their achievements while also anticipating their future accomplishments. To add to the significance of today's ceremony and demonstrate support for the newest endowed chairs and the medical school's partnership with UMass Memorial Health, we are privileged to be joined by UMass System President Marty Meehan. I am pleased now to invite President Meehan to the lectern to offer remarks on behalf of our university system.
Thank you very much, Terry, and good afternoon to all of you. I'm delighted to be here for this special investiture celebrating 8 members of the UMass Chan Medical School's esteemed faculty. I'm excited to be here to honor our newest endowed chairs and the people who made this day possible. First, I want to recognize UMass Memorial Health President and CEO Eric Dixon for the institution's $5 million philanthropic gift. Without Eric, today's event would not be possible. Eric and I had been discussing the prospect of a significant scholarship contribution for UMass campuses for some time. I remember having dinner with him almost a year ago in Lowell. And after consulting with Chancellor Collins, we identified opportunities for endowed chairs that he thought would be excellent targets for this. And the rest is history. Eric, we are extremely grateful for the generous support from you and your UMass Memorial team. It means so much to the university to have the support of UMass Memorial and to have you as our partner. We're also appreciative of the UMass Foundation for providing $2.5 million in matching funds to further the impact of the UMass Memorial gift, resulting in an endowment of 5 chairs that we're here to celebrate. I strongly believe that this matching gift is an important step for us to take to honor the significance of this gift from UMass Memorial. And of course, we must acknowledge the UMass Chan team for making their own investments in this as well, as the medical school is designating $6 million from the quasi-endowment to establish 4 new endowed chairs, one of which we're investing today. I also want to thank Chancellor Michael Collins for his leadership of UMass Chan Medical School. For almost 20 years, Chancellor Collins has been at the helm of this incredible institution during many of its most significant milestones. The historic $175 million gift from the Morningstar Foundation, its substantial expansion in research impact and funding, its rise to #1 in the Northeast for primary care education, and of course, Dr. Victor Ambrose Nobel Prize in Physiology or Medicine, which we celebrated here last month. I also want to recognize the leadership of Provost Terry Flood, whose contributions to this medical school over his career here have had a pronounced effect both in volume and impact. Terry, thank you. But we all know well that it is the faculty who truly make this medical school so special. And as leaders at UMass, we are proud to be out there telling the stories about the successes that belong to so many of you who are here in this room. I am a firm believer in UMass Chan's steadfast focus on advancing together, and I applaud UMass Chan's team's success in building a scientific community and setting a tone that puts our outstanding faculty and students front and center. Collaboration, service, a deep commitment to excellence have helped define the UMass success story. My time as UMass president has reinforced my belief in this university's impact and power to transform lives. I have learned more about the special contributions each of our 5 campuses makes to advance our public mission across the Commonwealth. I have seen the global impact of UMass teaching, research, and service. And day after day, I meet students and alumni who share their personal stories about why they chose UMass and how it transformed their lives. We have 5 campuses serving the Commonwealth of Massachusetts and beyond in various ways, but it's the sum of these parts that make the impact of the University of Massachusetts vibrant and strong. In our commitment to research, we understand the importance of engaging in public and private partnerships that will continue to bring together universities and hospitals and research and biotech and industry talent. That type of collaboration is exactly why Massachusetts is a leader in this space. There is no better place in the world, better equipped than Massachusetts to drive fast and effective responses to global health threats. And the teams at UMass Memorial Health and UMass Chan are central players in moving this critical work forward. UMass Chan's research, education, and service are leading efforts to find potential treatments for cancer and other human diseases, to drive health equity in our communities, and to educate the next generation of caregivers and scientists. We are incredibly fortunate to have highly accomplished faculty who are making these life-changing contributions, which is why I want us all to stay laser-focused on drawing the greatest minds in medical research fields to the University of Massachusetts. When faculty come here, we want them to know that they are joining a collaborative, inclusive culture focused on sharing ideas, brainstorming to spark medical breakthroughs, and serving our communities together. That's why the University of Massachusetts and UMass Chan are so special. Congratulations to all of our esteemed faculty being honored today. On behalf of everyone at the University of Massachusetts, thank you for all that you do for UMass Chan Medical School and the Commonwealth of Massachusetts. Thank you.
Good afternoon, President Meehan. Thank you very much for those remarks and, more importantly, for your presence at today's ceremony. Your involvement and participation elevate our proceedings, and we thank you for your continued support and leadership of the university. This ceremony will commence with the investiture of the 5 UMass Memorial Health chairs, which have been made possible by the generosity and partnership of our primary clinical affiliate, UMass Memorial Health. Before inviting our first faculty member up to the podium, it's altogether fitting and appropriate to ask Dr. Linda Young, the chair of the UMass Memorial Health Board of Trustees, and Dr. Eric Dixon, president and CEO, to join me at the podium. Linda, if you would come here. Great. Thank you. Doctors Young and Dixon, and through you to the other clinical system trustees and leaders in the audience, today we celebrate the extraordinary history and impactful partnership of UMass Memorial Health and UMass Chan Medical School. Our aligned missions bring world-class education, research, and healthcare to communities across central New England, while advancing learning and discovery that will transform medicine globally. Our interwoven destinies date back nearly half a century, when UMass Memorial Medical Center's University campus first opened as a tertiary care hospital, and where students from UMass Chan, and still in its infancy, could undertake clinical experiences in high-quality medical care in every specialty. The medical center soon flourished as a training ground for physicians and a frontline provider of critical medical services, opening the region's only designated Level 1 trauma center for adults, along with such other essential units as a high-risk maternal and neonatal care center. Service expansion and growth continued over the years, including a merger with Memorial Healthcare. Today, UMass Memorial Health is the largest health system in central Massachusetts, touching countless lives through outstanding, accessible clinical care, high-performing areas in almost every clinical specialty, and a commitment to the region's children comprise the clinical expertise that resides within our clinical principal affiliate. At UMass Chan, steadfastly, we fulfill our public service mission to educate the next generation of healthcare providers due to the commitment to medical education that is the hallmark of UMass Memorial Health. Indeed, academic medical centers are a cornerstone of medical education. At UMass Memorial Health, we see the power of innovation and clinical translational care, creating an ecosystem that advances the fields of medicine and nursing alongside the simultaneous and relentless pursuit of healing for every patient. Now, through a most generous gift from UMass Memorial Health, enhanced by additional funds from the UMass Foundation, we honor highly accomplished senior physician leaders who bring their extraordinary talent to our institutions on behalf of the patients in central Massachusetts and indeed around the globe. A grateful medical school expresses its sincere appreciation to the board and management, caregivers, and staff of UMass Memorial Health for its generosity and enduring partnership. Please accept these 5 medallions that will soon adorn the next 5 UMass Memorial Health endowed chairs, as a token of the medical school's sincere gratitude for the investment you have made to advance the mission at our Commonwealth's world-class public medical school. Indeed, we thank you. Thank you. Eric, thank you. Can we take a picture here? We begin this afternoon's ceremony by investing Dr. M. Diane McKee as the inaugural recipient of the UMass Memorial Ledwith Chair in Family and Community Medicine. Dr. McKee and Julia Scanlon, the daughter of our beloved late colleague, Dr. Jim Ledwith, would you please come forward for the presentation? How are you? If you go to the second box, please. Thanks. Diane. Champion of healthcare equity, innovator of patient-centered research, engaged and progressive physician and teacher, Dr. M. Diane McKee, it's a privilege to recognize you today at this special investiture ceremony. Your career has led you from Cornell University and the University of Tennessee College of Medicine in Memphis to training as a resident physician in family medicine at Memorial Hospital of Rhode Island, to a position as professor and vice chair of research in the Department of Family and Social Medicine at the Albert Einstein College of Medicine in New York. As the founding director of the New York City Research and Improvement Networking Group, you sought to influence practice and improve health outcomes for urban primary care practices. Research support while in New York came from a broad range of sources, including the Patient-Centered Outcomes Research Institute and the Montefiore Einstein Institute for Clinical and Translational Research. You joined UMass Chan and UMass Memorial in 2019 as the newly recruited chair of the Mission Critical Department of Family Medicine and Community Health. At UMass Chan, you lead an academic department at a medical school that has been perennially ranked among the top in primary care education in the U.S. News & World's annual report, and its rankings of medical school, which has been a focal point for our academic and clinical relationships with primary care providers throughout the region. Further, your collaborative research serving as a selection committee for the co-chair of UMass Memorial Medical Group PACE Awards is much respected. In addition, you devote your time and expertise by serving on UMass Memorial Community's Health Links Board, extending your commitment to providing compassionate, high-quality care to some of our community's most vulnerable residents. A passionate and prolific researcher, you have published more than 90 papers in professional journals, and you have received many well-deserved honors, notably including induction in 2013 to the Leo Davidoff Society at Albert Einstein College of Medicine. It is fitting that you hold this newly endowed chair named in memory of James Ledwith, MD, a respected and beloved colleague in family medicine and community health, whose unexpected death this summer has left a void in the hearts of his family members, colleagues, patients, and students. It's especially poignant that members of Dr. Ledwith's family join us as together we celebrate and reinforce his enduring association to the academic department he contributed so much to as a senior clinical leader. To Dr. Ledwith's family members with us today, including his wife, Ann Madigan, his son, Michael, and his daughter and son-in-law, Julia and John Scanlon, know that we honored Dr. Ledwith's life and legacy by having his name attached to the endowment reserved for the incumbent leader of his home department. With appreciation to the Ledwith family and with sincere gratitude to UMass Memorial Health for making this endowment possible, I now ask Julia to assist me in investing Dr. McKee as the inaugural recipient of the UMass Memorial Ledwith Chair in Family and Community Medicine. Please accept this medallion as a sign of UMass Chan's high regard for your past, present, and future contributions to our medical school and clinical system and the broader fields of family medicine, community health care, and primary care. Congratulations. And we'll take a picture. If you would just change positions, please. Julia, I know this has been an exceptionally challenging few months for you and your family. Your father's sudden passing continues to weigh heavily on our academic community and is acutely felt in the Department of Family Medicine and Community Health. While he will be forever missed, we wish to celebrate and keep alive his memory for years to come. We're grateful to have been colleagues of such a caring, compassionate, and beloved physician educator who meant so much to so many in our midst. Please accept this medallion as a tangible reminder of the clinical systems and our medical school's commitment to honor the rich legacy left by your father, an exceptional faculty member and caregiver. You're welcome. Thank you for being here.
Well, thank you, Chancellor Collins, Provost Flott, President Meehan, Drs. Dixon and Young, distinguished colleagues. It really is an honor and a privilege to accept this chair, and it's especially meaningful that it coincides with the 50th anniversary of family medicine at UMass. We were a founding department, and among the first graduates of the medical school were 3 brave souls who chose a new discipline of family medicine that was focused on breadth, not depth. And it was built on the long history of the GP with the core principles of first contact care, continuity of relationships, comprehensiveness, and coordination. And the founders of our discipline were rebels who saw the increasingly fragmented healthcare system as unacceptable and sought to care for whole people in the context of family and community. During my residency, there was very clear realization that we had to train generalists to practice based on the best available evidence. But there was also concern that if all we did was consume evidence that was generated by specialists, that we were not doing our discipline and our patients the best, providing them with the best care. We too needed to be generators of new knowledge. We needed to be scholars ourselves and root the evidence for high-quality primary care in our own practices. Practice-based research networks had been around, but family physicians with research training were few and far between. Mentors were very hard to come by, and most departments were still viewed as not very scholarly. So this is what lit the fire for me. I pursued the path of becoming a primary care investigator, following the principle that if we wanted more evidence-based practice, we needed more practice-based evidence. There are many people to thank for helping me along this journey, starting, of course, with my family. There were key mentors who were role models during residency, who were leaders in primary care research and were able to demonstrate that we could identify very important questions from practice and that the answers would make a difference. And early at Einstein, the chair of family and social medicine and the dean invested in my development to become the first clinician investigator who was a family physician at Einstein. I also want to thank my first mentor, Mike Mulvihill, who was instrumental in helping me get started with the early mentored research funding from the American Cancer Society and the Robert Wood Johnson Foundation. But mostly I want to thank another group of people who go unrecognized. Doing health services research in primary care meant asking busy clinicians and office staff to participate in research on top of their usual day job of patient care. And they quite literally were core to every single project that I have ever completed. And without them, the work could not have been done. This army of people were typically neither funded nor on the author lines. So I really need to thank all of those folks who helped to generate the evidence to improve the quality of care. So it's especially fitting that this chair will be a lasting tribute to Dr. Ledwith and all that he meant to our discipline and to our community. As we've heard, Jim embodied so much of what we strive to be: an excellent, compassionate clinician, a wonderful mentor, a skilled educator, and a caring colleague. Also someone who was willing to keep learning across the decades of his career. It's my privilege to be the holder of this chair, and I thank his family for sharing him with us and for being with us today. Thanks.
Next, we are privileged to invest Dr. J. Matthias Walls, the inaugural recipient of the UMass Memorial Carr Chair in Anesthesiology and Perioperative Medicine. Dr. Walls and Dr. Kumar, would you please join me at the podium? Sanjay. Esteemed caregiver and educator, committed mentor, dynamic scientist, Dr. J. Matthias Waltz, it's a privilege to recognize you at today's special investiture ceremony. The UMass Memorial Carr Chair in Anesthesiology and Perioperative Medicine is named after Shubi Carr, MD, the late and previous chair of Anesthesiology and Perioperative Medicine, who for 30 years served as a leader at our academic medical center and who was beloved and respected by all who knew her. She left us with her legacy of passion for teaching and patient care. Dr. Walls, as Dr. Carr's longtime colleague, since your arrival here in 2005 and more recently since 2018 as her successor, you have ably led the Department of Anesthesiology and Perioperative Medicine, making unparalleled contributions to the integration of health informatics into patient safety and research initiatives. You are active in numerous professional organizations and have invested in the department's research expertise, supporting National Institutes of Health and PCORI-funded grants. You've been a member of the UMass Chan community for a quarter of a century, having completed your internship and residency training in anesthesiology and a fellowship in critical care medicine here, after earning your medical degree from the University of Tübingen in Germany. The focus of your research is on measuring and improving patient-centered outcomes in operative, postoperative, and intensive care environments, which have spearheaded initiatives for patient mobility in postoperative settings. The use of non-invasive hemodynamic monitoring, and recently advancing technologies for patients in ICUs so that they may more easily communicate and interact with caregivers. Under your leadership, the Department of Anesthesiology and Perioperative Medicine is one of the largest clinical departments with more than 160 clinical providers, a team that performs more than 60,000 anesthetics each year, and offers highly complex tertiary and quaternary care services to the diverse communities served by our clinical system. Finally, you oversee quality patient care across a very large clinical platform, supporting surgical and procedural services across all of UMass Memorial Health. Your commitment to the patient experience in the most intensive clinical settings was of immense consequence during the COVID-19 pandemic, when you served as the physician leader for the surge response in critical care disciplines. You are a highly collaborative physician scientist and are actively engaged in patient care, teaching, research, and mentorship, ensuring excellence in all three mission areas of academic medicine and robust career development opportunities. It's a privilege to invest you as the inaugural holder of the UMass Carr Chair in Anesthesiology and Perioperative Medicine at UMass Chan Medical School. Please accept this medallion as a sign of our steadfast respect and commitment to your burgeoning academic career here at UMass Chan. Congratulations. Okay, we'll take a picture. Okay, if you just switch. Dr. Sanjay Kumar. Sanjay. We're humbled to welcome you, your daughters Simran and Shivani, and your son-in-law Jason to campus today. We're particularly pleased to have Shivani, a proud graduate of our T.H. Chan School of Medicine. Welcome back, Shivani. A beloved wife, mother, colleague, and academic leader, Shubi Carr passed away in May of 2018. Her passing was an incredible loss for those of us who knew her in her professional home. Although we continue to miss her presence, her personality, and her expertise, her legacy and enduring contributions are evident all around us, including, of course, in the example of Dr. Walsh, who was mentored and befriended by Dr. Carr. by formally attaching her name to the endowed chair that henceforth will be reserved for the leader of the department she so brilliantly led for so many years. The clinical system and this medical school will ensure her memory is celebrated in perpetuity. This is a fitting tribute to a universally loved leader who contributed much to our academic mission. Dr. Kumar, please accept this medallion as a tangible example of our commitment to extending and elevating Dr. Carr's legacy here at our medical school.
Thank you, Chancellor Collins, for those kind words. President Meehan, Dr. Stixon, Dr. Young, Provost Flott, I am deeply honored and humbled to be receiving this endowed chair today, and am particularly grateful for the generous donation of UMass Memorial Health and the UMass Memorial Board of Trustees. Having this endowment named after Dr. Kaur is such a wonderful thing and a true testament to her accomplished tenure, not only as a clinician caring for our patients and a gifted educator to our learners, but as an inspirational leader in so many roles, to include chair of the department between 2015 and 2018 when her remarkable tenure was ended so prematurely. It is a real privilege to have Shubi's family here today to celebrate this moment with us, as this really was one of her stated goals and wish to see the department receive an endowed chair. Having it named after Shubi carries very special significance for me. She was such a wonderful mentor and friend for me personally since I came to this organization back in 2000. And what I have experienced at UMass Chan and UMass Memorial Health has been a wonderful professional journey full of support and opportunity and encouragement to take things to the next level. Whatever we achieve in life, professionally and personally, we stand on the shoulders of those who came before us. I would like to thank a Chair Emeritus, Dr. Stephen Hurd, who was a trailblazer for us in so many ways, mentored to many in the room, to include our CEO and President, Dr. Eric Dixon. I would not be standing here in front of you without Shubi and Steve as being part of my professional journey. Provost Flott, I want to thank you for your guidance throughout my tenure at UMass Chan. You have been a trusted advisor long before I took on the role as department chair, and that really means a lot to me, personally and professionally. I would like to thank Dr. Robert Simpson, who has been joining me as an executive coach and mentor advisor over the past 4 years, which, as many of you know, have been challenging with the pandemic and what came after, particularly in our specialty where we were hit with significant national staffing shortages that to this day have a profound impact on the healthcare system. But I can share with you that I'm very optimistic that together we can see our way through these challenges, get to the other end of it, and continue to expand access and deliver world-class healthcare here at UMass Memorial Health. I want to thank my peers in this room for their collaboration, support, and invaluable ideas they are willing to share with me whenever I am looking for creative solutions during these challenges times to move us all forward. A very big thank you to the members of the department who are here today. We have weathered a few storms over the past few years. What the department, in collaboration with so many departments, divisions, and caregivers across this enterprise have done during the COVID pandemic has been truly remarkable, and I'm sure that it has saved a lot of lives. It is the greatest privilege of my professional career to be working for all of you in the role as department chair, and I promise to leverage the opportunities afforded to us through this endowment to the benefit for all of our caregivers and learners in the department. Lastly, and most importantly, I owe a mountain of gratitude to my parents who always supported my professional aspirations. Even when I told my dad, who was a trauma surgeon, I'm going to go into anesthesiology, that didn't go down well initially. And then I told him I'll go to the US for a couple of years. I think that ended up being a little bit longer, thanks to the professional environment I found at UMass Chan and UMass Memorial Health. My wife, Joanna, and my 3 wonderful daughters, Lucy and Joanna, are here in the audience today, and I think Emily and Hannah are streaming this event from the UK. Thank you for all that you do. Whatever I have been able to accomplish in the professional realm would not have been possible without you, and I love you all to the moon and back for sticking with me through the ups and downs. Thank you all so much.
Now it's my pleasure to invest Dr. A.M. Barrett as the inaugural recipient of the UMass Memorial Chair in Neurology. Would Dr. Barrett and UMass Memorial Health Board Chair, Dr. Linda Young, please join me at the podium. Acclaimed physician scientist, innovative researcher of brain behavior relationships relevant to spatial cognition, caring mentor, and physician dedicated to person-centered care and rehabilitation. Dr. A.M. Barrett, it's a privilege to recognize you at today's special investiture ceremony. In 2022, you joined UMass Chan Medical School and UMass Memorial Health as Professor and Chair of Neurology and Chief of the Neurology Service of the Veterans Affairs Central Western Massachusetts Healthcare System. To UMass Chan, UMass Memorial, and to patients across the heart of New England, you have brought the dual benefits of rich experience and evidence-based research in neurorehabilitation, visual and neurocognitive science, and cognitive neurology. Your most important expertise in stroke and neurological rehabilitation has been developed, deployed, and demonstrated at the Emory University School of Medicine, the Atlanta VA Healthcare System, the Kessler Institute for Rehabilitation in New Jersey, and as a faculty member at the Rutgers, New Jersey Medical School and Pennsylvania State University College of Medicine. Your extensive experience and multifaceted expertise weaves together training in cognitive neurology, rehabilitation, and neuropsychology, and has positioned you as a renowned leader and model for clinicians, students, trainees, and fellow researchers alike who seek to understand and rehabilitate their patients' spatial cognition and hidden deficits. Board certified in neurology, behavioral neurology and neuropsychiatry, and brain injury medicine, you earned your medical degree at New York University Langone School of Medicine and undertook residency training at Columbia University and a fellowship in behavioral neurology at the University of Florida. With more than 40 studies and peer-reviewed publications to your name, you are a sought-after speaker at academic forums and a contributor to books and policy papers. Recognized widely for your contributions to the field of neurology, you're a fellow of the American Academy of Neurology, the American Neurological Association, and the American Society of Neurorehabilitation. You're also a fellow of the Hedwig van Emeringen Executive Leadership in Academic Medicine Program for Women at the Drexel University College of Medicine. In recognition of your contributions to advancing neurological research and promoting the healthy return to function for veterans and others with disabilities, it's a wonderful privilege to invest you as the inaugural recipient of the UMass Memorial Chair in Neurology. With heartfelt thanks to the leadership of UMass Memorial Health for their commitment to our medical school and our linked destinies, I'll now ask Dr. Linda Young to assist me in investing Dr. Barrett. Dr. Barrett, please accept this medallion as a demonstration of the great respect we have for your passionate dedication to neurological research and clinical care, to our nation's veterans, and to our Department of Neurology. Congratulations. Thank you. Take a picture.
It is an amazing honor to be here today, to be invested as a UMass Memorial Health Endowed Chair. This role advances my ability to work with our neurology department, our very strong neurology department, on realizing our purpose, our department purpose, groundbreaking research, transformative education, and compassionate clinical care to resolve neurological disease. When people have issues affecting the brain, the spinal cord, and the nerves and muscles, they can have their own clinicians here at UMass, and also they can have their own educators, and also they can have their own scientists in the Department of Neurology. So I am so grateful to the UMass University of Massachusetts Foundation, President Meehan, to UMass Memorial Health, to Chancellor Collins, President and CEO Dixon, Dr. Young, who was here with me a moment ago, Provost Flott, and all of our colleagues, especially my colleagues from neurology who join me today. I stand among an outstanding group of scientists and leaders who make up our UMass community, and among the leaders, of course, of our neurology department and neuroscience departments. I was drawn here because UMass neurology and neuroscience in general is an outstanding example of how each mission supports the others. This is the place where translation and insight is taken seriously. We bring discovery to the clinic, we bring clinical research to practice, and we bring practice knowledge and observation to new discoveries. I'm so grateful for the recognition dual appointments create here, unifying our research, education, and healthcare efforts. The endowed chair is valuable to assist me in continuing to pursue my own research, which, as said, draws on both patient care and brain science, and ties our department to the Veteran Administration. I have the privilege of providing medical care for veterans here at our community-based outpatient clinic across the street, and I work beside veteran men and women here at UMass. I live in a community where veterans are celebrated and recognized, and that is amazing. I'll continue to study hidden disabilities that affect function and freedom, leveraging knowledge of brain behavior relationships and cognition, especially spatial cognition, and my hands and the hands of our nurse practitioners in our department are part of the treatment of spatial disorders that neurology is providing in the lab and in the clinic here at UMass and at the VA, a treatment that can cure spatial neglect after stroke and vertically improve quality of life. So some thanks. Luann Thorndike was my introduction to the UMass community. Bob Brown was one of the first to greet me here. Jerry Vaughn, Mary Ahn, and Andy Carson mentor me, along with Provost Flott. And I especially thank the search committee who brought me here 2 years ago. My research and brainstorming partners are also incredible. Hong Wang Lin, Dave McManus, who's here today, Kristen Maddox, Emily Muller, Lisa Chanette, Stacy Wynena, Akila Sanjay, Sue Jacobs, Karen Griffin. Shout out to our terrific department resident and fellow trainees and physicians, our department executive leaders, and those who steer the ship on our medical student and resident activities, Wissam Deeb and Kate Danello. Our neurology administrative partners, John Beauchesne and Mo Briza Ferreira, are also stars. And the biggest thanks of all go to my husband and my best friend, James McGowan, and our children, Blake and Ellie, and all of my extended family for their love.
Next, we are privileged to invest Dr. Max Rosen, the inaugural UMass Memorial Chair in Radiology. Dr. Rosen and Dr. Linda Young, would you please come forward? A highly respected and renowned physician, a passionate academic health sciences leader, inspirational teacher and mentor to emerging professionals, scientists, and faculty alike. Dr. Max P. Rosen, it's a privilege to recognize you at this special investiture ceremony. The UMass Memorial Chair in Radiology is a fitting recognition for your dual role as a physician scientist leading the Clinical Systems Department of Radiology, while engaging in interdisciplinary partnerships to advance world-class translational research into neurodegenerative diseases, stroke, and aneurysm treatments, and taking advantage of AI technology to help detect breast cancer in its early stages. After nearly 2 decades practicing interventional and abdominal radiology at Beth Israel Deaconess Medical Center, in 2012, your career led you to UMass Chan, where you assumed the role of chair and professor of radiology. Over the past 12 years as chair, you've nurtured and guided a vibrant radiology department, growing its staff to nearly double in size with more than 90 radiologists, 40 scientists, 26 preclinical teaching faculty, and dozens of residents and fellows. Because of you, the Department of Radiology now performs approximately 900,000 studies per year, providing subspecialized radiology services around the clock at sites across UMass Memorial Health System while conducting research and supporting the next generation of learners and caregivers. Your current research interests include the use of eye tracking technology to help radiologists better understand what they may or may not be seeing on imaging, and the use of machine learning technology to accurately communicate findings in a radiology report. You are an impactful academic radiologist and celebrated physician scientist. Since joining UMass Chan, you have flourished, and we anticipate the most productive years of your career in research and medicine are still to come. It's a privilege to invest you as the inaugural recipient of the UMass Memorial Chair in Radiology at UMass Chan. Please accept this medallion as a symbol of the highest esteem we have for you as an academic leader, colleague, and physician scientist. Congratulations.
Thank you.
Want to take a picture? Sure. Linda?
Okay.
Okay.
Okay. Thank you. I'll tell everybody.
Thank you.
Thank you. Wow. All right. Sort of hard acts to follow. So, Chancellor Collins, President Meehan, Dr. Young, Dr. Dixon, the whole UMass Chan medical school community, and the UMass Memorial Health community. I really want to thank you. This is an incredible honor to be the inaugural holder of the UMass Memorial Chair in Radiology. Like everyone who receives an endowed chair, there are several people in my life to whom I'm really grateful. I'd like to start with my parents, who are unfortunately no longer here. My dad showed me how to listen to people with a slight dose of skepticism. He had a small sign on his desk that read, "There are 3 sides to every story, yours, mine, and the facts." My mother would be especially proud, and receiving this chair might somewhat make up for me not becoming, as my mother would have said, a real doctor. Like her PCP, Dr. Fain, or my pediatrician, Dr. Lenny, who both made house calls. In medical school, I thought I would become a psychiatrist and then migrated to internal medicine. Eventually, I left it up to the match whether I was going to be a radiologist in Boston or do a medicine residency in New York. Fortunately, the match made the right choice for me. Throughout my career, I've had wonderful mentors who not only taught me how to read imaging studies and perform image-guided procedures, but also provided incredible non-clinical opportunities for me. When I started my residency at Boston City Hospital, I met Alan Greenfield, who adopted me into his world of interventional radiology. Alan was the ultimate team builder and had a gift for providing excellent patient care while making every day fun and transforming everyone who worked with him into part of his family. I've also worked for 2 wonderful chairs, Sven Paulin, who hired me for my first job at Beth Israel Deaconess, or Beth Israel back then, and Herb Kressel, who I worked for over 10 years. Both Sven and Herb gave me increasing levels of responsibility, encouraged me to, quote, figure things out, and helped me discover how much I enjoyed administrative challenges. Over the past 30 years, the technology and practice of radiology have changed dramatically. I am old enough to have trained in the days of film, view boxes, dark rooms, and getting called in the middle of the night to do a pulmonary angiogram. Radiology departments now function 24/7, 365 in a digital world. departments have morphed from small, fairly intimate workplaces to sprawling IT conglomerates spread across time zones. Despite all the technology, the most important part of radiology for me has been the people I work with. I've been fortunate to be paired with the great hospital vice president for the past 12 years at UMass, Alice Shackman, and she's partnered with me to run the clinical department, and a superb group of preclinical faculty who make me wish I had gone to med school at UMass. I've learned an enormous amount about how to run a research enterprise from Matt Gunas, who always makes research look easy, even though it never is. And also, I've just had the great pleasure of working with two wonderful administrators, Cindy Wilson and Randall Malwood, who really helped me run the department on a daily basis. If I were to diagram out the people in my radiology world, there would be only a few degrees of separation between almost everyone. My Aunt Charlotte was the first and only radiology nurse at the Beth Israel in the 1980s, and early in the 90s, I was able to work with her for a few years after my fellowship. She was a very important person to me, my son Sam, and Sam's mom Judy, who are here today. Radiology is also responsible for me marrying Jean and becoming Claudia and Andrew's stepfather, the result of a blind date arranged by a matchmaking colleague who's best known for her fetal ultrasound and MRI textbooks. Jean is a thoracic radiologist at MGH and has been a constant source of support, encouragement, guidance, providing great perspective on anything I'm trying to figure out. And Jean and my son Andrew are here today also with Sam and Judy. Unfortunately, daughter Claudia is tied up in school taking exams. Claudia and Andrew's grandfather, Herman Heimovicci, was a radiologist who built the practice at Health Alliance, which is now part of our department here at UMass. Receiving this endowed chair is the highlight of my career. It's a great honor, and I hope to be able to use the resources associated with the chair to create opportunities for others in my department that help pay forward what so many people have provided for me. Thank you.
Now it's my pleasure to invest the 5th UMass Memorial Endowed Chair, Dr. T.J. Fitzgerald, as the inaugural recipient of the UMass Memorial Chair in Radiation Oncology. Dr. Fitzgerald and Dr. Young, would you please join me at the podium? Thank you. Highly collaborative academic leader, researcher on the cutting edge of radiation oncology, highly respected scientist. Thomas T.J. Fitzgerald, MD, 80. It's a privilege to recognize you at today's special investiture ceremony. You're a longstanding member of the UMass Chan community. First, as a learner and 1980 graduate of our School of Medicine, and since 2004 as chair and professor of the Department of Radiation Oncology. You are the director of the Imaging and Radiation Oncology Core Quality Assurance Review Center, and are one of the primary investigators for the National Clinical Trials Network of the National Cancer Institute. Under your leadership, the Department of Radiation Oncology continues to grow and provide state-of-the-art clinical treatment to people across Worcester County and beyond who are living with cancer, delivering tens of thousands of teletherapy treatments each year and providing extensive brachytherapy services to patients. Your career continues to grow in prominence, as does your scholarly output in the field of cancer research. You have authored more than 200 published manuscripts about clinical, translational, and basic science discoveries, including research in radiation basic science for tumor control and tissue injury. Always striving to improve patient care and outcomes, your research interests include signaling pathways, the study of cell adhesion molecules, and the impact of anti-adhesion therapy as a co-partner to radiation therapy for epithelial disease, and the application of expertise in bone marrow biology for hematopoietic leukemia and lymphoma stem cell populations. A proud alum, your dedication to UMass Chan's mission areas earned you the 2019 UMass Chan Alumni Distinguished Service Award. You are a committed leader in academic medicine and higher education. We have tremendous respect for your commitment to cancer research, quality assurance in radiation oncology, and gratitude for the impact you've had on the UMass Chan community, our faculty, learners, and staff over so many years. It's a privilege to invest you as the UMass Memorial Chair in Radiation Oncology at UMass Chan. Please accept this medallion as a token of the great pride we have in calling you one of our own and the high esteem we hold for your clinical acumen. Congratulations. TJ, congratulations. Just take a picture here if you could.
Oh, sure.
Yeah. Thank you.
Well, I appreciate the recognition, and also want to thank school and system leadership for recognizing Shuby and Jim Ledwith. It is a very terrific honor, and it's great to see their families. Those I worked with Jim in North County, and he was a terrific clinician. And Shuby, I can't tell you the number of times she's saved my day, helping me with PD anesthesia at 7 o'clock in the morning. A very special individual. We miss them both, but I'm very appreciative that they're recognized. Now, for those of us here, it's important to recognize that we're sitting on sacred ground, because a few of us are old enough to remember that underneath us was the original parking lot of the medical school. Yeah. At that time, these were some of the halcyon days of the medical school, because we had the opportunity every evening to talk to Alan Jacobson, Thoreau Peterson, Jim Dolan, Sam Clark, the ambidextrous Ken Wolfe, some really special people at that time. The important point is that they all had a signature and influence on all of us. And the medical school was very personal, very unique, and we had an opportunity to grow and thrive under their leadership. It was a new school, and we needed that recognition and drive to be able to succeed for the next step. And with that, they gave me the opportunity to be able to move forward and achieve, residency and training that otherwise I wouldn't have had an opportunity if I didn't have their expertise and support. I want to thank Chancellor Collins, Dean Flott, and Dr. Dixon especially, because as the school has grown and matured and we now cover the geography of Massachusetts, that personalized signature still remains. And it's an important step, because every student that we see during their success and some of the times and the troubled times that they've had as well, the safety net's been out. And it's, with frequency that we get calls to be able to, with Newtonian motion, just put that individual in motion to get them on the right pathway. And that component of the school exists and is very vibrant today, despite our growth and our geographical expansions. Department of Radiation Oncology was actually the last department started on the original charter of the medical school, and we started in 1984, and I was recruited back at that time with the support of Jim Dolan to start the department. Today it's a very robust environment where we cover multiple geographies, and that's really due to the support of school and system leadership. Chancellor Collins, Dean Flott, and Eric Dixon have made enormous contributions to the department, and it's been my privilege to help put the puzzle parts together. It's a great department, and we look forward to continue and leverage its strengths for the collaborative growth of all of us. So thank you again.
Next, we're privileged to invest Dr. Dorothy P. Schaefer, the inaugural recipient of the UMass Chan Medical School Chair in Biomedical Research 1. Dr. Schaefer and Dean Flott, would you please come forward? In the box, if you would, thank you. Exceptional scientist, trusted mentor, noted pioneer in field of neurobiology and neuroinflammation. Dorothy P. Schaefer, PhD, it's a privilege to invest you at today's special ceremony. Your contributions to the fundamental mechanisms of neurobiology have advanced the understanding of how microglia, a subset of neurons in the brain, support synaptic remodeling, memory, and neuroinflammation. Your discoveries progressively illuminate our understanding of the links between neuroinflammation and neurodegeneration, the findings of which could prove to be of major significance in global knowledge of Alzheimer's disease and other forms of dementia. A graduate of Mount Holyoke College, you received your PhD from the University of Connecticut Health Center in 2008, continuing on to serve as a postdoctoral researcher and founding member of the Beth Stevens PhD lab at Harvard Medical School and Boston Children's Hospital, where you helped identify a key role for microglia in pruning synapses in the developing visual system. You joined UMass Chan in 2015 and are now an associate professor of neurobiology. Here, your lab focuses on the fundamental role microglia play in neurobiology, brain development, neurological disease, and synaptic connectivity. Your impactful peer-reviewed publications have appeared in some of the most prestigious scientific journals, including Nature, Nature Neuroscience, and Neuron. Earlier this year, the UPenn Mahoney Institute for Neurosciences named you a Rising Star for your contributions to neuroimmunology research, and the Brain and Behavior Research Foundation recognized your innovative thinking in neuropsychiatry with the Freeman Prize for Exceptional Young Scientists. As a mentor, you are investing in developing and guiding the coming generation of scientists, having guided nearly 50 student learners since 2015 and serving on numerous qualifying exam, thesis research, advisory, and dissertation examination committees. In recognition of these many accomplishments that highlight your burgeoning and impactful scholarship and many years of anticipated future contributions to UMass Chan Medical School and the broader field of neuroscience, we're pleased to invest you as the inaugural holder of the UMass Chan Medical School Chair in Biomedical Research 1. Please accept this medallion as a symbol of our commitment to supporting and investing in your thriving academic career and brilliant research program here at UMass Chan. Congratulations. Really well done. You take a picture?
Thank you so much, Chancellor Collins. I think you need to say that every time I look in the mirror in the morning. I hope we recorded that. So thank you so much for this honor. It's just it was an amazing day to have the Chancellor show up at my door, my office door, while I'm having a meeting with a trainee, so thank you. So I wanted to give a little bit of my life story, and don't freak out, Tim, if you're in here. No, it's not going to be long, but I want to give that to just preface what UMass Chan means to me. So I was raised in a small town in Indiana. We had 100 people that graduated from my high school class. Just a very small handful of us went on to a 4-year college. I did go on to get a neuroscience degree at Mount Holyoke College, and then a PhD at UConn Health Center, really focusing on neuroscience, and then a postdoc at Harvard Medical School, where we started to make fundamental discoveries on how these surprising roles for molecules that are normally involved in fighting infections and how they actually regulate normal neural circuit development and involve these cells, microglia, which are resident immune cells in our brain and spinal cord. And so when I came to UMass in 2015, I come back to that because it's really the first time where I have not had imposter syndrome. I always felt like I didn't belong, that I wasn't worthy of where I was, and UMass Chan has really been the first place where I did not feel like that. It provided a place where I could really flourish, be myself, make exciting scientific discoveries, innovate, and a highly collaborative atmosphere, and it really comes from top down. I think Dean Flott, Chancellor Collins, you create an atmosphere that allows people to do that, and I want to really thank you for that. I know a lot of bad stuff, for lack of better terms, can roll uphill, and you seem to deal it flawlessly, and thank you. And I then wanted to thank my home Department of Neurobiology, and also the Immunology and Microbiology program. Both have been fantastic groups of colleagues and a community for me from my time starting at UMass Chan Medical School. In particular, a couple of my mentors who are not at UMass Chan anymore, but Vivian Budnick, my former chair, and Mark Freeman, the former vice chair, who really provided initial guidance. I've also, Kate Fitzgerald has been a phenomenal mentor to me also going forward. So thank you. But in reality, I've had many, many mentors here at UMass, and it's just too much to name right now. But and amazing collaborators and colleagues that I've had the really privilege to learn from. And I look forward to Danny as a mentorship as well, my new chair, Danny Winder. And then I want to move on to my lab. I couldn't do any of this without my lab. It's really my extreme privilege every day to mentor such wonderful, amazing people. They have taken my research from looking at neural circuit development, now looking more in neuroinflammation and going more in translational realm and translating potentially our findings to clinic. And I can't thank them enough for just being able to be in their presence every day. Kind of also going into my family, I'd start with my mentor family, and that's my graduate mentor, Matt Rasband, and my postdoc mentor, Beth Stevens. But then getting more deep into family here, my mom is here. My mom has been such a tremendous source of support going, as I have grown up, but into my scientific career too. And even here, she's here helping me watch my kids. And I think there's not a lot that I could do without her support. Thank you, Mom. And Hank, and then her husband. And then I wanted to thank my kids, Avery and Liam, who are also here, for being awesome and putting a smile on my face most days, and just being just amazing people to watch grow. And it's I can't speak enough about how amazing it is to be a mom. And then finally, my husband, Christian Hedstrom. Christian has really just been my support system and rock through my entire career. He's been a wonderful partner, both in family, but also in science. He's also a scientist. And so when you have to have scientific discourse with somebody and an argument, and you have to live with them too, you have to come to a compromise and see the other person's point of view. And he really taught me that skill set. So thank you so much, Chris, for everything. And with that, thank you again. And this is such an amazing honor. Thank you.
Now it's my pleasure to invest Dr. Anil Chandrakar as the inaugural recipient of the Jack M. Wilson Chair in Biomedical Research. With Dr. Chandrakar and UMass President Emeritus Jack Wilson, please join me at the podium. Outstanding physician investigator whose contributions have deepened our understanding of end-stage renal disease, transplant immunology, and transplant-related infectious diseases. Translator of basic science discoveries in immunology to clinical interventions for patients. Dedicated advocate for what could be. Dr. Anil Chandrakar, we're delighted to invest you at today's special investiture ceremony. Your current research is focused on developing immune modulators that might one day allow patients to accept donor organ transplants without the need for often challenging immunosuppressing medications. While the standard of care for transplantation has been to place patients on heavy immunosuppression to prevent rejection before transplantation, doing so can increase the risk of infection and malignancy in the long term. You're working to use circulating immune cells from patients after transplant to expand their regulatory population of cells with the idea that we could reinfuse these cells into the patient and thus reduce the need for burdensome immune-suppressing drugs. Funded since 1997 from sponsors such as the National Institutes of Health, the National Kidney Foundation, Alexion Pharmaceuticals, and the U.S. Army Medical Research Institute, your lab has generated 140 publications of high-impact journals, including the Journal of Clinical Investigation, the Proceedings of the National Academy of Sciences, and the American Journal of Transplantation. A hallmark of your translational research is pragmatism, combined with paradigm-shifting discoveries. Following your medical education and residency training in the United Kingdom, in 1998, you joined the faculty of Harvard Medical School as an instructor and were later promoted to assistant and then associate professor. During this time, you served as medical director of kidney and pancreas transplantation and director of the Transplantation Research Center at Brigham and Women's Hospital. You joined UMass Chan earlier this year as professor of medicine and chief of nephrology, where you continue to make a difference in the lives of patients across our region and indeed across the globe. With deep appreciation for the impact of your translational research and the impact that has had on nephrology, our understanding of immunosuppression and transplant patients, we're pleased to appoint you as the inaugural Jack M. Wilson Chair in Biomedical Research at UMass Chan Medical School. Please accept this medallion as a token of the utmost confidence we have for you as a physician investigator and senior clinical faculty leader. Anil, congratulations. If you could just change positions. Well, it's both a personal and professional privilege to welcome UMass President Emeritus Jack Wilson to today's proceedings and to have this endowment in a public and permanent way be associated with an exceptional leader whose legacy here at the medical school and throughout the UMass system continues to shine brightly. President Wilson served as the 25th president of the University of Massachusetts from 2003 to 2011 and oversaw a period of tremendous growth and achievement in the university's history. Both Dean Flott and I are most grateful that he selected us for our positions here at the medical school. And of further note, he selected then Congressman Meehan to lead his alma mater as chancellor at UMass Lowell. President Wilson, your talent spotting legacy is unparalleled. After stepping down from his system role, President Emeritus Wilson continued to be a staunch and spirited advocate for the medical school by being an active, engaged, and thoughtful trustee on the UMass Memorial Health Board. Jack, we're so pleased that you and Judy join us today, and we remain forever grateful for your leadership, support, and advocacy. Please accept this medallion as a token of our enduring appreciation.
Thank you.
Take a picture.
Thank you very much.
Well, that's a little overwhelming, I have to say. President Meehan, Drs. Dixon and Young, thank you for being here. Thank you, Chancellor Collins, Provost Flott, and President Emeritus Wilson for bestowing upon me this inaugural Jack M. Wilson Chair in Biomedical Research. It is a tremendous honor to accept this on behalf of the Department of Medicine and my colleagues within the Renal Division. I joined UMass Chan at the beginning of the year after spending most of my professional career at the Brigham and Women's Hospital as a researcher and clinician interested in improving the lives of transplant recipients through research. I came to UMass Chan because I recognized the remarkable opportunities that exist at this institution to improve the lives of individuals through clinical and translational research, and because of the vision and support of the leadership at this institution. I learned that President Wilson and I share a connection. He was trained as a physicist, as was my father, who was an academic physicist. I think if my father had been alive today, he would have in equal measure been immensely proud and somewhat surprised by where my journey has led me. It is, of course, only natural on occasions like this to reflect on how your career has taken you to where you are. After finishing medical school, I wasn't certain of what I wanted to do and focused on training as a clinician, first in internal medicine, and then later as a nephrologist, and then as a transplant nephrologist. As a clinician, I came to realize that the limitations of clinical medicine, what the limitations of clinical medicine were, and developed a curiosity about research. That curiosity turned into an interest, and that interest turned into a passion. The curiosity, that in turn led me through a circuitous route to move to the United States and invest some time in learning about transplant immunology, which is how I ended up in Boston. Along the way, I've always had the benefit of mentors who were able to see within me the potential that I could not see at the time. Without these mentors, who not only guided me but gave me opportunities, I would certainly not be here today. I would particularly like to acknowledge the influence of Drs. Bernie Carpenter and Dr. Mo Sayegh. They brought me to the Laboratory of Transplantation and Immunogenetics at the Brigham and Women's Hospital and Harvard Medical School, even though I had no prior bench research experience. When I started as a researcher, I believed that the problem that I was going to work on during my fellowship, transplantation tolerance, meaning the ability to transplant an organ from one individual to the other one without the use of non-specific immunosuppressive medications, would be solved in short order. That has not happened as of yet. But I do believe that we are entering a period in which the rate of change of medicine is occurring at such a fast pace that he has the potential to radically transform the way that we practice medicine in the next 10 to 20 years. It is an exciting time to be in medical research and an exciting time to be at UMass, where there's an incredible opportunity to be in the vanguard of many of these changes. And of course, lastly, I would be remiss if I did not thank my wife, Samir, who's here today with me, for allowing me to pursue my interests and move from country to country. And my twin daughters, Shahela and Aisha, who could not join us today, but have always been supportive of my career. And of course, I would like to thank my parents, who provided me with support and the self-confidence that I've relied on throughout my career to take the opportunities that have been presented to me. Thank you once again for this tremendous honor.
And now it's a distinct pleasure to invest Dr. Fernando J. Martinez as the inaugural recipient of the Joseph D. Early Chair in Biomedical Research. Dr. Martinez and Worcester District Attorney Joseph Early Jr., would you please come forward? Fernando, if you'd go. Good job. Thank you. World-renowned physician scientist, recognized for seminal studies in advanced and chronic lung disease. Experienced pulmonologist dedicated to improving treatments for your patients. Prolific biomedical researcher. Fernando J. Martinez, MD, MS, it's a privilege to invest you at today's special investiture ceremony. You're known internationally for landmark research in the phenotypic and functional classification and clinical interventions in chronic obstructive pulmonary disease, COPD, and interstitial lung disease, ILD, and in the development of consensus documents that have set the standards for care for patients with these conditions. With more than 670 publications and 13,000 citations to your name, you're ideally suited to have led the international group responsible for drafting and periodically updating the COPD care standard, which has been published under the auspices of the Global Initiative for Chronic Obstructive Lung Disease. Numerous investigations into the pathogenesis and clinical trials of potential therapies for COPD and ILD, funded by the National Heart, Lung, and Blood Institute, have elucidated new knowledge, which you share in many ways, including by serving as editor-in-chief of the prestigious American Journal of Respiratory and Critical Care Medicine, otherwise known as the Blue Journal. You arrived at UMass Chan earlier this year from Weill Cornell Medical College in New York, where you were the chief of pulmonary and critical care medicine and the Bruce Webster Professor of Medicine in the Joan and Sanford I. Weill Department of Medicine. After earning your medical degree from the University of Florida and a master's in biostatistics and clinical design from the University of Michigan School of Public Health, you completed your residency in internal medicine at Beth Israel, a clinical fellowship in medicine at Harvard Medical School, and a pulmonary fellowship at Boston University. As the inaugural Vice Chair for Clinical and Translational Research and Academic Chief of the Division of Pulmonary Allergy and Critical Care Medicine in our Department of Medicine here at UMass Chan, you will help us to advance our clinical and translational research missions by increasing the number of high-impact trials and investigator-initiated trials, and promoting scientific inquiry among early career physicians and scientists. In recognition of your many contributions to clinical and translational research, the care of patients with pulmonic illnesses, and of your contributions yet to come, it's a pleasure to invest you as the inaugural holder of the Joseph D. Early Chair in Biomedical Research at UMass Chan Medical School. Please accept this medallion as a symbol of the high esteem our medical school has for you and for your seminal work. Congratulations. Thank you so much. Thank you. Randall. If we take a picture here, please. Let you switch positions. District Attorney Early. It is, we don't really know each other that well, do we, Joe? District Attorney Early. It's wonderful to welcome you and many members of the Early family today to honor the immense legacy of the Early family patriarch, your beloved late father, Congressman Joseph Early. Your father was a pillar of the Worcester community and Massachusetts political establishment for decades. He was from Worcester, for Worcester, and about Worcester. Indeed, for nearly 20 years, he was an undeniable force and a ubiquitous presence as the Worcester congressman, who worked 7 days a week to be a voice and advocate for his constituents. His early support for locating the Commonwealth's public medical school in his hometown was critical to the ultimate success of what was then a grand but far from certain experiment to conceive of, construct, and operate a medical school of the highest quality here in our community. Now, while he first and foremost championed his district, he also used his time in Congress to emerge as one of the nation's most influential and passionate advocates for medical research. He brought the same level of grit and tenacity that made him a standout basketball player at Holy Cross to his far-reaching campaign to increase funding for biomedical research. From cystic fibrosis and juvenile diabetes to AIDS and breast cancer, among other diseases, Congressman Early was an essential voice within the halls of Congress for the value proposition associated with federal funding of biomedical research. Affectionately referred to as Mr. NIH by his congressional colleagues, Congressman Early also was this medical school's secret weapon at a time when we most needed his help. It's altogether fitting that a name synonymous with NIH research should be attached to an endowed chair now held by a physician scientist whose groundbreaking research has informed the practice of medicine. District Attorney Early, it is heartening to know that you carry forth your father's inspiring example and steadfast commitment to public service and to the Worcester region. On behalf of a grateful medical school, please accept this medallion as a constant reminder of this institution's appreciation for the myriad and profound contributions of your father.
That was so nice. That was the nicest thing anyone said about Harvard. Thank you so much.
All right, I'm the last person before you get drinks. And so I promised Tim that I would not tell you my entire life story. Thank you so much. It's quite an honor. And I wanted to specifically thank Drs. Collins, Flott, McManus Dixon and Young for allowing me to sort of transition from an immigrant from a small rural town in Cuba to sort of the pinnacle of a career. Thank you, all of you, for allowing me to achieve that. I've only been here for about 3 months, and so I'll take the opportunity to give you, what was the term, David, the newbie view of the institution. It is a daily basis that I see the incredible commitment to clinical care, education, investigation, and their merging. That is a unique ethos for an institution. You should be proud of that. I am proud to be here to allow you to advance that. I had a medical procedure done a couple of weeks ago, Dr. Dixon, and I can tell you that from 6 in the morning, the security guard in the front of the hospital to the leadership of the institution, there's a tremendous sense of community and collaboration. That's also a unique feat and makes me extremely proud to be able to contribute to that. As I promised him, I was not going to congratulate 400 people. I'm going to congratulate 5 individuals. I'm going to thank 5 individuals on behalf of what they've allowed me to achieve. The first was my mentors. You cannot achieve these goals without having mentors in life. One of them is Bart Shelley, Dr. Collins, a person that you know quite well at BU, who was my mentor at Boston University, and Galen Taves, who was an innovative translational immunologist at the University of Michigan. They're a large part of the reason that I've had the career that I've had. Then I have family to thank. My mother immigrated to the United States with 4 children alone in a suitcase 54 years ago last week. She's not here. She would have loved to have been here for that component. My father came years later, was a pediatrician in sole practice in northern Florida, Palatka, Dr. Flott, you would recognize that. Dr. Rosen, your mother would have considered my father a real doctor since he made 10 to 12 house calls per night. It's part of the reason I didn't go into pediatrics, just to point out. And so, I owe them tremendously for allowing me to be here. And probably the person that I owe the most is here today, and that's my wife, Colleen, of 40 years, who I met at the Beth Israel, not the Beth Israel Deaconess, the Beth Israel, so you know exactly how long ago that was. And she has put up with me for 40 years. That's a lot. And she fortunately has raised my 2 children, who are model citizens. And now I have grandkids. If you don't have grandkids, guys, wait till you have grandkids. It is something else to behold. The last comment I'll make is District Attorney is for you and your family, so that it is particularly poignant, my name is attached to your family's name. Because having been involved with the NIH for decades, I knew, in fact, that Representative Early was known as Mr. NIH. And so you guys have to comprehend the amount of time that this gentleman created to support biomedical enterprise research, clinical care. For therapy prevention, your dad was ahead of the game in these components, to the Commonwealth of Massachusetts. And I wouldn't be standing here if it wasn't for his work to get UMass in Worcester. I think you said he bled Worcester. I think that was your comment earlier. And so I thank you and your family. And not to mention that you should look at a picture of his father. You can see it's a splitting image of his dad. It is really something to behold. So I thank all of you for allowing me to come here and aid you in this wonderful endeavor. And thank you to you and your family and to your dad for facilitating this. And I'm going to stop and let you guys go to the reception. Thanks very much.
Ours is a most special community, defined by a collaborative spirit and characterized by individuals who excel in their endeavors, whether that's in education, research, patient care, or philanthropy, as in the case of our generous donors. The support of our benefactors is most vividly demonstrated through our august group of named professors, which, as Provost Flott mentioned previously, total 71 in number. These compelling institutional ambassadors collectively underscore why at UMass Chan we're advancing science, medicine, nursing, innovation, and hope together. The presence and participation of so many of our esteemed professors reflects and reinforces the special collaborative and collegial culture that distinguishes and defines our medical school. Given time constraints, it's not possible to individually introduce and recognize each named professor who joins us today. I would, however, ask these most accomplished faculty members and standard bearers of excellence to stand as a group so that we can recognize you. Indeed, it's a privilege to have each one of you with us this afternoon. In the future, we'll look forward to other meaningful opportunities to celebrate the achievements of all of our endowed chairs, especially the 8 recognized at today's ceremony, and to properly convey the enormous gratitude we feel to benefactors like UMass Memorial Health and the UMass Foundation that make these highly coveted faculty positions possible. This concludes our 2024 special investiture ceremony. I would ask that our guests remain seated while our endowed chairs and medal recipients recess out. I'd like to invite Dr. Jean Frazier, the recipient of the 2024 Chancellor's Medal for Distinguished Service, to carry the university mace and to lead our recessional.